Hey everybody, we're hanging out in the garage today. My husband is working on finishing like a couple walls in our garage so that I can do, hello dude, so I can do more of my programs here at home instead of having to go to the clinic and record stuff. I can keep doing that, but like when I get pregnant, God willing, then when I do my pregnancy program and like early postpartum program, I can just do that at home. So I'm going to go over a couple things here that are kind of the hot topics from this week's polls. The lower back, kind of chronic like lower back pain, tension, the tailbone pain, and then the strength increasing. So I'm going to go over each of those. If you're not interested, just skip through. And you know I get a little sciencey about this stuff, so hang with me. Number one is the like low back, hip pain, and those of you who are just kind of like dealing with that as a chronic situation. I realize that this is common postpartum. It's common for, I mean, the most common diagnosis I see in the clinic is low back pain, right, or neck pain or something like that. But low back pain, deep butt pain, hip pain, those can all be secondary to or because of pelvic floor dysfunction. So for those of you who are dealing with these things, make sure that your provider knows, make sure that your PT knows that you're dealing with these other symptoms as well, because they can help diagnose or figure out exactly what tissues might be the culprit, or if it's more of a strengthening thing, like you need to support your body better to reduce that type of pain. That's a huge one. I'll talk through a couple other things here. This is something that I struggle with too. I've had low back pain on and off since high school, I think, so like half of my life probably. I didn't really understand the cause and the drive behind it until I got older, when I realized I have a lot of hypermobility in my body, and so strengthening is hugely important for me. If I don't strengthen, oh my gosh, my husband. If I don't strengthen, my symptoms come back. My prolapse symptoms come back. My low back pain comes back. My abdominal pain, hip pain, all that comes back. That's for me. I know a lot of you, the majority of you, are hypermobile, right? Prolapse in young people often comes hand in hand with hypermobility. So if you're experiencing a lot of these things, you might consider progressing with your strengthening. And if you're not sure how to do that, let me know. I'm happy to help guide you. Pop Principles covers a lot of that. Low back and hip pain, glute pain can also be nerve related, so you can make sure that your physical therapist is ruling that in or out if that might be a cause. It can be a joint dysfunction, so our facet joints in our spine, our SI joint can refer pain to different areas and can be drivers. The discs in our spine, so between the vertebrae, they actually have nerve endings. They're not just these things that exist without any innervation. So if there's been any sort of irritation to that tissue, who knows why, that can be a driver of pain as well. There are numerous things that can cause hip and low back pain. Even GI stuff, some GI things can refer. Gosh, I mean, the list goes on and on and on. But the moral of the story is, if you're dealing with some chronic type low back, hip pain, discomfort, get it treated. There are options. It might mean some work on your part, but get it treated. Okay, moving on to the tailbone pain. Coccyxdynia is the diagnosis of what that is. So the coccyx, the tailbone, has a ton of pelvic floor muscles that attach to it. I don't have my really awesome model or like print with all the pelvic floor muscles written out, but I can show you in the clinic if you guys want, or I can just share a reel where I've already used that image. But I do have just like a general printout. It's not exactly the anatomy, but at least I can kind of show you what's going on. All right, so here's the pelvis. You're looking down into it. This is your sacrum. Okay, these are your innominate bones. Here's your pubic bones. This would be the opening to the vagina. Your urethra would be here. It's not there. Like I said, I don't really like this image that much. And here's the opening to the rectum. Here's your tailbone. Okay. And as you can see, all right, so here we go. Tailbone, all these pelvic floor muscles attached to it, right? So puborectalis would wrap around, pubococcygeus attaches to that. We have Coccyxdynia, these all attach onto the tailbone, right? So if there's tension in these surrounding tissues, they pull, and that can cause tailbone pain, okay? There's also a muscle called the obturator internus. It has a referral pattern down the back of the thigh or directly to the tailbone, so that can be a driver of tailbone pain as well. Someone asked if you can do releases rectally with a wand, and the answer is yes, but I would definitely get assessed by a physio before you do that and just get some instruction on how to do it, because the rectal tissues are very fragile.